packed agenda, I'm going ahead and getting started, although I continue to expect that people will continue to join because we did have more than 50 people registered for this program. We are being recorded. You probably saw the notice saying that it's being recorded. The recording will be posted to our YouTube channel shortly after we finish, and slides from the presenters will be posted to our league website shortly after the program as well. There is a link to our website in the digital goodie bag that was sent out to all registrants. That'll make it easier for you to access the slides if you wish to do so. On behalf of the League of Women Voters of Manatee County and the Healthcare Committee, especially those members who helped put together this virtual and informative event, I warmly welcome you. We have on our call Rebecca and Linda Vertufay, who both were members of the Planning Committee from the Health Committee, and I am the chairman of our Health Committee here in Manatee County. I am also the League's representative to the Manatee Healthcare Alliance. This event is really part of our League's mission to encourage informed and active participation of our citizens in government through education. So thank you very much for joining us this afternoon. To set the context for this event, why this event at this time, we are actually one of thousands of events being held around the globe to commemorate and support the United Nations Universal Health Coverage Day. This calls for all nations to provide all their citizens with affordable, quality health care. The purpose of UHCC Day is to raise awareness of the need for strong and resilient health systems and universal health coverage. At present, at least half of the world's population does not have access to essential health services. In the United States alone, approximately 28 million citizens are uninsured, which means they struggle both to obtain and to pay for and access essential health care. All United Nations member states, including the United States, signed the Declaration on Universal Health Care in 2012. Now, group advocates, such as the League of Women Voters of Manatee County, are taking their turn to send a message to provide health care for all, protect everyone. We also care about each of you as you have signed up for this educational program. So if you have not yet had a chance to open your digital goodie bag, which includes the Starbucks coupon as well as links to a lot of good information, they are in there, and in the goodie bag and those links and our presentations, we have information to help you get and sustain your comprehensive health, physically, mentally, medically, emotionally, and mindfully. We have 6 expert presenters. So let me say a few words about our meeting logistics with regard to questions. Each speaker will present their prepared remarks. As you have questions, please put them in the chat. At the end of each presentation, I will pull questions from the chat to ask each speaker. It's likely that we won't get to every question before needing to move on to the next presenter. After today's event, we will go through the chat and we will pull all of the unanswered questions. We will work with the presenters to get the answers to your questions and provide answers to all those questions to all attendees. So remember, please put your questions into chat. And now I'd like to move on to our first distinguished presenter. I'm pleased to announce and introduce the expert who knows the most factual and up-to-date data on the health of Manatee County residents, Dr. Jennifer Bencie. Dr. Bencie has been the County Health Officer for the Florida Department of Health in Manatee County since August of 2009. She oversees a staff of 150 and $24 million budget. The agency is involved in many population health initiatives, including worksite wellness, school health, environmental monitoring, and most recently, of course, the COVID-19 response. In her over 24 years with the Department of Health, Dr. Bencie has also served in leadership roles in the health departments in Orange, Seminole, Miami-Dade, and Bay counties, as well as the State Health Office in Tallahassee, overseeing the Division of Emergency Medical Operations. Dr. Bencie is a board member of the Manatee Memorial Hospital, Centerstone of Florida, the Manatee Healthcare Alliance, the Bishop Museum, the local Ivy League Club, International Women's Forum, Florida Suncoast Chapter, and the Arts and Health Coalition of Sarasota, Manatee. Jennifer received her undergraduate degree from Brown University, her medical degree from UAG, Mexico, and her master's degree in health administration from Central Michigan at Fort Gordon, Georgia. Dr. Bencie, it is our pleasure and privilege to have you with us. Please, if you have slides, you can go ahead and share your screen.
Great. Thank you so much, Ruth, and good afternoon, everyone. We appreciate the opportunity, my team and I, to present to you today because it's always a team effort. And it's also a pleasure to be with our partners in the community who we work so closely with this afternoon as well. So with that, I will get started because I know there's a lot of information to share. First and foremost, I'm going to talk about our Community Health Improvement Plan, or our CHIP, which is done every 3 years based on the work of the community during the CHA, the Community Health Assessment. So just to give you some brief information here, as you see, the population we know in Manatee County is growing daily, well over 410,000 now. We know we have seasonal residents, we have a lot of visitors. We are the 14th most densely populated county in the state. So we're very fortunate in that we do have many resources in our community, everything from beaches, parks, recreational and sports amenities, a vibrant cultural community, strong health infrastructure, engaged business community, and international airport and seaport. So of course, many people want to be here because of all of these amenities, and so we need to determine how to best serve them all. So through this CHA and CHIP process, which I'm going to talk more about, and then our Community Health Director, Runa Badal, will be speaking more specifically later on in the program about the current CHIP. This is a requirement of every health department and hospital in the country every 3 years. So again, bringing our partners together through our Manatee Healthcare Alliance, which I'll talk more about, to make this happen and really determine what is best for the community based on their input, all of our input, in terms of improving the health of our community. In terms of demographics, you can see that our county really is a microcosm of the state. Our largest population is the 25 to 54 age cohort. Manatee does have a higher percentage of the population than Florida with the 55 to 65 cohort and the 85 plus cohort. We rank 13th out of 67 counties in Florida for the percent of persons age 65 and older. So diverse, growing, as you can see in terms of population, foreign-born individuals joining our community continues to increase. What I will also talk about briefly here is the income, a very important issue, persons in poverty, 11%. Those of you who are familiar with ALICE, through the United Way, the asset limited, income constrained, employed population. Roughly in Florida and in our community, at least 30% of the population meet that criteria, which means those working individuals, maybe 2 or 3 jobs they're working to make ends meet, meeting the very, very minimum ALICE criteria. If you add that to those in poverty in our community, it is over 40%, as it is in most of the state. I've had the pleasure of working on the ALICE committee since its inception in Florida. We were one of the early states, and now over 20 states around the country are participating in this important data gathering and assessment of the economics in our society and how it relates to the health of our communities. Also important to understand the changes of the population over time. As with the most of Florida, the population in Manatee is expected to increase 12% by 2025 and up to 34% by 2040. During the same time frame, as I mentioned earlier, the Hispanic population is projected to increase by nearly 62%, and Black and total non-white populations are projected to increase by nearly 44% each. Okay, the next slide, my favorite slide in my role as a health officer. It really it easily explains what the health of a community looks like. This is based on the Robert Wood Johnson Foundation and the University of Wisconsin County Health Rankings. This is done yearly. It's been going on for about 10 years now. Basically, what we look at are the social and economic factors first and foremost. 40% of an individual's and a community's health based on these type of indicators: education, employment, income, family and social support, community safety. Extremely important for health. Next, we go to health behaviors, 30%. Again, those individual choices that are made about tobacco use, diet and exercise, alcohol and drug use, sexual activity. Then we move on to clinical care, 20%, access and quality. That surprises people. They usually put that at the top of the list. But if you really look at the diagram, you can see the importance of these social and economic factors that come into play as it relates to health. And then finally, the physical environment. And while in the past, this hasn't been as much of an issue, in the last few years with red tide and blue-green algae being present in the Gulf, we do see respiratory diseases, skin concerns, et cetera, because of the environmental quality changing here in the community. I will say that I'm very proud that over the 10 years that this has been happening, we have continued to improve our rankings as a county. So this year, we are up to number 9, so broke the top 10 of the 67 counties in Florida regarding the health of our community. However, we do need to be careful because, as you'll see, the health factors, we're at 25 out of 67. And I think this is going to be important across the state, across the country, because we're all going to be impacted by COVID, mental health issues. And so we compete against each other. So if other counties aren't doing as well, we may rank better than them. But at the same time, we really need to keep an eye on this because it does predict the future of the health of our community. So again, at the end of the day, all of this, it links to ultimately the quality of life and the length of life. So really important. And I'm proud to say, as again, we've broken the top 10. I would say in Florida, the counties that tend to have more resources, for example, St. John's, Sarasota, they tend to rank in the top 10. Others, particularly rural communities in Florida, tend to not do as well. Again, some of them don't even have a hospital. So it really a lot of variables there. But we are definitely on the right track, and I'm so proud of where we are and the work of the Alliance in wanting us to break the top 5 and eventually become the healthiest county in Florida. So when I talk about the work of the Alliance, we all come together to look at where the gaps are in our community and try to find solutions. to those. One of my favorites is the community paramedicine program, just to give you an example. At least 5 years ago, could be even longer than that, the way time flies lately, but we came together and decided that there were a lot of people who were using the emergency rooms when they really didn't need to be there. They could have used other resources in the community. And so we looked around the country and said, you know, what is being done? And EMS was very excited about this opportunity to train some of their paramedics here in the county to become trained to go into the homes and work with those individuals who are identified, usually through the emergency room, of having certain diseases that could be better managed if they were seen more routinely in an outpatient setting, such as diabetes, congestive heart failure. So we started the program, and I just can't say enough. It really is now a national model, but all came out of the Alliance and the need to try to address that issue in our healthcare community. Another one would be the OD2A grant. Runa will talk more about that. We knew we had tremendous problems in 2016, 17 with fentanyl and other substances in our community. And so getting this grant from the CDC and working with our partners, we continue to address this issue and find improvements and solutions to address the concerns. And we know this is going to be extremely important, again, as I said earlier, as we move through COVID and beyond. Next slide. Okay. So I'm going to end here, other than saying that for those of you who don't know, the Manatee Healthcare Alliance was formed in 2010, and it's a nonprofit, 501c6. The purpose of it was, again, to work on the community health assessment, community health improvement plan in Manatee. The original founders, if you will, and required board members, the county government, the Chamber of Commerce, the health department, and a private provider or private individual or entity in the community. At the time, it was Jonathan Fleece, who was at Blaylock Walters, who was one of the founders with us. But now we have over 100 members. And again, our main role is to monitor the health of the community and find those gaps and provide solutions. So I'll stop there, and Runa will be able to go into more detail later. Thank you.
Well, thank you, Dr. Bencie. I have not seen any questions posted in chat, but I did get some questions from the Healthcare Committee beforehand. So I've got a few questions for you. You have a broad range of responsibilities. What are the things that cause you as the health officer the most concern or keeps you awake at night?
Oh my. I would have to say right now, the shortage of staff, we all need more individuals to be able to provide all the services that we do. And so making sure that we're working with the education system to try to mentor youth and to bring these programs into our health department, into the hospitals, into the healthcare settings where those individuals who need that experience, that training, can get that while they're still being educated in the classroom, and then keeping them in our community afterwards. You know, nurses, obviously, a tremendous need. I have the pleasure of sitting on the Centerstone board, and I'm so proud of the work that's been done there in doing residency programs. Once LECOM came to the community, we really put an emphasis in all of the hospitals to try to develop those residency programs, and the great majority of those being trained in the hospitals for internal medicine or specialties now are staying here in Manatee County, and that's what we need. We need to continue to have this pipeline, if you will, of individuals who are healthcare experts who are in our community and want to stay here. So some of us can retire later on and have peace of mind that the improvements will continue.
Oh, wonderful. We can't help but ask with regard to COVID. There has been, you've been publishing regular statistics showing the progress in being able to vaccinate the Manatee County population. But could you provide the latest, just a few facts with regard to vaccination status in Manatee?
Absolutely. And I always have the papers on my desk because it does change daily, but it always is the topic of discussion. So basically, we are continuing to make progress. We have vaccinated at least 66% of our population who are eligible for that. We are putting a great emphasis on addressing those who are new into the opportunity, the youth, in terms of getting vaccinated. We also are one of 3 health departments in the country that have a vaccine hesitancy coordinator working with populations who may be skeptical or need more education on vaccines. So we continue to work with everyone, and we have sites all over, whether you want to go to retail pharmacies or you want to come to us. We did just open last week a new site, a permanent site down near the Sarasota Bradenton Airport on 41 for vaccines. So please let us know if you need more information. Chris Tittle, I'm sure all of you receive emails from daily, can get you anything information-wise that you may need. But we continue to see increases. Our rates are going up a bit. We're about 3% positivity. The last couple of weeks, we were at 2% positivity. We have almost 68,000 cases. Fortunately, our deaths are going down in terms of seeing them on a daily or basis now. Unfortunately, we still see them, but much less frequent. So we're a little over 1,240 right now. So again, with the variants that are out there, with people coming to visit, we really want to emphasize please continue to wear your mask, social distance, hand washing, and vaccine if you can.
Thank you. We do have a question from the chat. You had referred to the community paramedicine. In some communities, a drug called Narcan is accessible. Is Narcan accessible here in Manatee?
I believe EMS does have it, yes. And during the time that we were dealing with the fentanyl, I remember many of the physicians in the community through the ER and the EMS medical director coming together to address the protocols and actually agree to offer more Narcan in the field for those who were dealing with a fentanyl overdose. So yes, EMS does carry it. And they are our first responders in that respect.
Thank you. Going back to the questions that had been sent to me beforehand, we can't help you. We've already talked about aspects of the vaccination program and the statistics with regard to COVID. But of course, in the last few days, the news has been full of the new Omicron. Omicron, I think I pronounced it correctly. Have we seen any cases of that in Manatee, or is it too soon for there to have been any impact yet from that particular variant?
As of yesterday, we have 2 cases in the state. One was in Hillsborough at the VA hospital, and one I believe was on the East Coast, Indian River, St. Lucie area. So what happens though with sequencing, not everyone who gets tested has their test sequenced. There's a process that all the laboratories around the state and country go through. So you're only sequencing so many of them for the variants. So it may be here and we just haven't seen it yet, but we will continue to promote the vaccines and the social distancing because we know that it is out there circulating. From what we've been told, though, at the national level, we still need to be very concerned about the Delta variant. It is still present, and that was the one that really caused so much hospitalization and unfortunately death in our community and throughout the country in the early fall. So we still need to be vigilant.
And my last question so far is, when do you anticipate perhaps that the health department in your sites will start being able to administer booster shots?
Oh, okay. We are all ready. So please feel free to reach out to us. And Chris can give you the number. We'll send that out to everyone. But by appointment, you can come to the health department here on 6th Avenue or our new site. The address is on Westmoreland, but it is on 41, right across from the runway at the airport. And that is open every day as well. That's just for boosters. So, and vaccine in general. I mean, we're not providing any other services there at this time. But yes, we are open, and we'll come to you if you do need a large group vaccinated. We can make that arrangement as well. And the community paramedics are also providing vaccines for those who are homebound as well.
Well, and I would point out to the people in our audience, if you are part of a larger organization, Dr. Bencie just said they can bring the vaccinations to your location. So you can feel free to reach out to her organization to arrange that if that's something that you would like to do. Dr. Bencie, I have to thank you so very much for the information you provided, a glimpse of the total scope of what you and your organization have responsibility for in terms of improving the overall health of the residents of Manatee County. So we appreciate all of your efforts and thank you for taking the time to speak with us this afternoon.
Well, thank you, Ruth, for your participation and for everyone. It's always a community effort. We appreciate the partnerships. Thank you so much.
And now I'm going to move on to introduce Melissa Larkin-Skinner. She is our next distinguished presenter. Melissa is a longtime resident of Manatee County. She is the Chief Executive Officer for Centerstone of Florida, a not-for-profit mental health and addiction prevention and treatment organization. Centerstone's mission is delivering care that changes people's lives. It's what guides Larkin-Skinner's purpose in helping children, adults, and families live fulfilled and healthy lives. Larkin-Skinner has served as CEO for 5 years and previously spent significant time as Chief Clinical Officer, overseeing all clinical programs and locations. She is a licensed mental health counselor and has nearly 3 decades of experience working in the behavioral health field. Larkin-Skinner started as a volunteer, actually, and has practiced in a variety of roles, including therapist, child welfare supervisor, and hospital administrator. With much service and leadership to our community, I will point out that she was recently appointed to the Florida Commission on Mental Health and Substance Abuse. Now, Melissa, if you would go ahead and share your screen.
So I don't have any slides.
Then we will look at your beautiful office and countenance.
Yeah, I'm not as prepared as Dr. Bencie. I have it all in my head. And besides that, I like to have kind of a conversation. So this is just me and my style. So I apologize for those of you who like more structure and slides that I don't have them. It is my pleasure to be here today to talk a little bit about mental health. Is a passion of mine. It's every time I hear my bio, I think, gosh, I got to rewrite that thing. And then I rewrite it and I hear it again. And I think, gosh, I got to rewrite that thing. I don't, it's just, it says a lot. I've done quite a bit. I can't believe I've been doing this almost 30 years. It's sometimes painful for me to say that, but it's also something I take great pride in. As hard as the work can be some days, and as emotionally draining as it can be, it is a wonderful thing to be able to bring to this community. It's a community I've grown up in. I've been here since I was 5 years old. Came for a little while when I was 3, but I've been here since I was 5. And so I take great pride in this community. I believe we live in paradise. And the more my organization and we can do to make it feel more like paradise, the better. So if I go back several years and we talk about the opioid epidemic, for those of you who were here, we were at a point where I personally, I walked out of my veterinarian's office one day and there was a dead person in the church parking lot next door. And that became a somewhat common story across our community, where people were dying in bathrooms at 7-Eleven, at the park, in their car, in the Walmart parking lot. And it was all driven by opioid addiction and sort of the evolution of opioid addiction, where the cartels and company were putting a substance called fentanyl in the drugs. And fentanyl is highly lethal in very small amounts, and people were shooting it up. And not only that, but even fentanyl can be absorbed through your skin, so there's a danger in touching it as well. So we put together, through great community effort, Drug Free Manatee really was leading the charge, and we put together a committee, a task force. We originally called it an opioid task force, and then we changed it to an addiction task force, because we knew that the drug of choice would change, because that is the pattern, unfortunately, when you look at addiction. So since that time, we made a dent. Narcan is available. It's actually available in many places. People can get it at local pharmacies. You don't even have to have a prescription for it. At least that's the way it was. I think it's still that way. So that is a good thing. Our community banded together to do all kinds of things, like drug take back days, handing out these little envelopes that you put old pills in and shake and it dissolves them. I'm sorry, my phone is ringing, which is extremely rare. Nobody calls my office. Anyway, let's see if I can silence this. I don't even know how to silence it. I'm not gonna mess with it. Anyway, so we did all kinds of things, and I believe that we made a dent in it. We made a dent in it. But what I couldn't believe is why. And people, I would speak about it, and people would say, "Why here?" Well, I have the same question. Why here? You know, we live in paradise. And I tell that story because it's important to recognize that despite the fact that we have all this sunshine, that people in general love living here, they keep coming here in droves. And I don't blame them. And we have these beautiful beaches, and out east we have a beautiful country. We have still a lot of pain, right? We have humanity. We're human beings, and human beings experience all kinds of emotions. None of us are immune to it. And no matter how perfect somebody's life seems, or how composed they are, or they seem to you, or how they seem to have everything, I'm telling you right now, every single human being experiences depression, anxiety, stress. We don't all experience addiction, but we all probably indulge in a substance that could lead to an addiction, which is important to remember. Caffeine is an addictive substance. I am addicted to caffeine. I get terrible headaches if I don't have it, and get grumpy. Tobacco, alcohol, which people kind of don't think about because it's such a social thing. So there are lots of things out there that are addictive, even though we don't all develop an addiction. We also don't all develop a diagnosable major depression. We don't all develop a diagnosable paranoia, but we absolutely all experience anxiety, depression, sadness, anger, frustration, defeat at times. And so because of that, it is incredibly important to attend to our mental health, our mental wellness. One of the evolutions I have experienced in my career is, historically, when we talk about mental health, it always has this sort of negative flavor to it. where we talk about it as in the bad things that it causes. We talk about it in terms of homelessness and jail time and hospitalization and illness. And the evolution, I believe, at least that I've experienced, is the desire to talk about it in a positive manner, because it is common. 40 million Americans experience, well, actually have a diagnosable anxiety disorder. 40 million. That's 18% of the adult population. So if you apply that to Manatee County, that's 75,000 of our fellow residents. In addition to that, another 19 million experience depression, and half the people that experience depression experience anxiety. And it's sort of a rolling thing, so that every year there's a certain number of people in our country, in our state, in our community who experience these things. So but what's important to note is that though we all do, and it's painful when you're experiencing it or a loved one is experiencing it, what we know is it doesn't have to last forever, that there's light at the end of the tunnel. And that's the thing that drives me. Is I've always said that when I no longer have hope, that's the day I need to retire. I need to immediately supply my resignation and retire. And so for me, it's really important to get out there to all of you and to all of our fellow residents and people who come in and out of our community, that there is an end. Even if your chemistry in your brain causes you to feel anxiety and depression at a higher rate and a higher intensity than most people, there's still hope. There's still light at the end of the tunnel, and it probably will wax and wane because that's the nature of mental health disorders, but we can make them better. We can feel better. So over the last several years, my first few years as CEO here were tough. I experienced a lot of things. Not a lot of them were pleasant, or a lot of them weren't pleasant. It's probably a better way to say it. And I had a lot of self-doubt, a lot of sadness, anger. I had moments of happiness, but it was really getting to me and was sucking the joy out of my life. And I enjoy life. I have an interest in a lot of different things, and I'm always moving. But it was sucking the joy away. And what I don't want is for other people to have to experience that. And so that's what drives me. Intellectually, I know everyone's going to experience it, but what I want to be able to do and what I want my organization to do is to help people get back up and keep going and learn from whatever it was that they were experiencing, feeling, no matter how negative it was, and then use that in the future when those other things we can't control come at us, to deal with those things and get past those things too, because it's inevitable. That's how humanity is. That's how our lives are. So just a little bit about us and about mental health here. In the last couple of years, we went from serving 16,000 people to serving 19,000 people annually. That is a huge leap. That happened in a 2-year time period. The other thing is that prior to COVID, we got around 6,000 to 7,000 calls per month. We now get 10,000 to 11,000 calls per month. That gives you a little bit of an idea of the demand, the need. I do believe COVID has disparately impacted or disproportionately impacted children because of the school situation, because of not being able to be with their peers for a period of time. There was this structure and normalcy that just went away, and everything was new. And then on top of that, all of their authority figures were arguing about what was the right thing to do and the best thing to do, and nobody could agree. So it left a lot of uncertainty. Human beings in general are not good with uncertainty, adults and children. So it's been a struggle. We have not seen an increase in suicides. Actually, we saw a decrease, which is positive. However, I sort of wait with bated breath because historically, when you have large events that affect a population, there's a lag. There's a time where you might see stability or a drop off, but then all of a sudden you'll see a spike. So we are waiting to see if that occurs, but we're also doing the work to try to prevent it from occurring by getting the word out about mental wellness, how to take care of yourself. So a little bit else. So when COVID started, one of the things I said is we absolutely have to keep providing services. We can't just shut down. It doesn't work that way. It would have been devastating for this community and every single person we serve, plus the people who love them and count on them, if we stopped providing our services. It was an impossibility. So what we did is within 1 week, we went to providing most of our services virtually, with the exception of the ones that we provide in the community and the ones we provide at our hospital, because that's not possible, right? To just do it by video. So today we have a hybrid. One of the positive outcomes of COVID is it really pushed the state and the federal government to alleviate some of the barriers from us being able to provide remote services. So we provided less than 1% of our services via televideo, and now we provide around 50% of our services via televideo. I see it as just an option for people who can't or don't want in person. And that's how we'll continue. But there's a lot going on in the realm of mental health, but what the message really needs to be is there are people who care. There aren't always enough of us. Dr. Bencie mentioned workforce. It is devastating to every employer at this point, and it's not unique to us, but we're doing everything we can to make sure we keep bringing the care that we provide and the information we provide to our community. So with that, I'll take any questions you have.
And Melissa, thank you so much for sharing a very personal perspective. It takes a lot of courage and leadership to do that. And I think it really set the tone for how much you care about the work that you do and how much you care about the help you and your whole organization try and provide to people. So that is really treasured. We have one question about, you mentioned behavioral health programs for youth, and wondering, you touched somewhat on the disruption that COVID brought to that, but could you talk about what you've been able to salvage or what you've been able to continue to do in behavioral health programs for youth?
Sure. So we went from a couple of years ago, we were in maybe 50% of the schools in Manatee County. We're now in 100% of the schools. And that's all public schools, including the public charter schools. And we provide services, and basically not the parents, but the parents can, but the schools, the teachers, the guidance counselors, depending on the school, will refer the kids to our services. We will do that individually for kids that are struggling, that come to the attention of the staff. But we also provide prevention type services where we go on and we really talk about the things that we all need as human beings to lead the lives we want to lead, like decision making, emotional regulation, problem solving, conflict resolution, things like that. Because the more kids and adults, frankly, have those building blocks, is how I see them, the better able they are to handle the things that come at them in their life. And so we do a lot of that, in addition to having some specialized services for kids who struggle with more severe mental health issues and their families. We serve the whole family. And we continue doing all of that throughout the pandemic, even going into the schools. We just had to follow the rules. We have rules in our hospital. If you come in, the schools have rules, and we just work together to make sure the kids were able to keep getting their services. And in some schools, we actually have some iPads like out in DeSoto County, so that if there's a problem and no one's there physically, they can connect through a provider here through the iPad.
Oh, wow. I had gotten a couple of questions beforehand from our health committee. One question is about veterans. Do you see much of a veteran population needing assistance, or do you have any special programs for veterans here in Manatee County?
So we do, and it is a particular focus for us. The stats I've seen is Manatee County has estimated somewhere between 40 and 50,000 veterans. That is a lot of veterans. The veteran suicide rate is twice not the non-veteran suicide rate. So it is a population that deserves certainly special attention. As far as Centerstone goes, we actually have a clinic up in Jacksonville called the Cohen Veterans Network Clinic, and they provide services specifically to veterans and families, and then families of active duty military personnel. We are able to access those. It is a Centerstone facility, and we are able to access those via telehealth for veterans here if needed. We also have some programs aimed at active duty military families. So specifically kids and working with them and dealing with, being a child in a military family and all the different aspects that go along with that.
Thank you. Lots of good services, as you were saying. I don't have any other questions for you at this point, Melissa, so I want to thank you so much again for your heartfelt presentation to us, but the statistics that you did provide, a person's life is more than a statistic, but to know the size of our veteran population in Manatee County, to know what some of the increases in issues have been, but your ability to use remote services, it's really helpful for us to know that. So thank you very, very much for the information you provided, Melissa.
Anytime, Ruth, anytime. Thank you for having me.
Thank you. For all of our attendees at this point, what we're going to be doing is providing a 5-minute break. Since this is a 2-hour program, we're going to give you a 5-minute break. Please remain logged in on your Zoom call, but you can feel free to stand up and stretch your legs or whatever. When we return, we're actually going to be changing the pace of this type of program. So please rejoin us after a 5-minute break. That would be at 1:55. Thank you. This is Ruth Heronshaw again, and I welcome all of you back from your little 5-minute break to be ready, as I said, to take a slight change of pace in our program. What I'd like to do is introduce Janet Rains. Janet is a member of the League and is on the Healthcare Committee. She has been a wellness coach for the past 3 years, leading women with compassion and accountability. She is passionate about the arts and serving her community. She loves connecting with new people, so feel free to send her a chat or connect with her on social media. Janet?
Thank you, Ruth. Good afternoon, everyone. I just wanted to take this time to remind you about your virtual goodie bag. Included in this PDF are several different resources, including a digital health guide, county health stats, and more info about our speakers. The goodie bag was included in your 2-hour event reminder email. I also have just put it in the chat. Now, with that being said, I have the extreme pleasure of introducing Jessie DiLorenzo. She specializes in alignment-based vinyasa, children's, and prenatal yoga. Jessie's mission is to empower students of all ages, drawing out the unique gifts and luminosity that already exists within all of us. She has led classes she's led classes and professional development workshops for students, educators, artists, and school leaders nationally since 2013. And in 2019, she received an award for leadership in arts education from the Arts and Cultural Alliance of Sarasota County. Currently, Jessie is the founder and director of the nonprofit Wholehearted Education, and you can learn more about Jessie in your virtual goodie bag. With that being said, Jessie, please take it away.
Thank you so much, Janet. So good to be here with all of you. I feel very, very lucky to be in such company. In a moment, I'm going to be guiding you through a meditation to help you tap into a feeling of peace and tranquility right within you. And my hope is that you're able to really take this and bring this feeling off this call and into the rest of your day, your month, and your year. So as we face challenges, which we know as the change makers you all are, we will, I hope you can remember how to use the fine instruments of your breath and simply your attention to tap back into that inner sanctuary. So many of you on this call, I know, already have your own mindfulness practices. But the great thing is when we have an opportunity like this to all be guided together, when we have the chance to breathe together, to focus our attention together, I'm even going to get us moving a little bit together, that connection we forge is really palpable, right? We have this really powerful cohort here. So I hope you join me. So let's just get our body loosened up a little bit. We've been sitting in front of the computer for some time now. I'm going to bring that music back, just a little bit of background sound for us to tune into. We're going to take a little retreat for the next 10 minutes. I hope you enjoy it. So sit up nice and tall. Maybe plant the bottoms of your feet, the soles of your feet on the ground. And just allow yourself to land in your body, in this space, in this time. Nowhere to go, Nothing to be, nowhere to be, except right here in this moment. Take a deep breath in, reach your arms up and overhead. Super simple movement practice here. You're going to take your right hand and reach for the back of your either left forearm. You can go for your elbow. If you have a little more space, you can wiggle down to your tricep and then press your head back in space. Keep reaching up through your left fingertips. And then as you exhale, bow over to your right. Give yourself a nice long side body stretch. So again, that forearm can be placed on the top of your head, or if you have a little more space, it can go behind. And you can start to soften your eyes here, just turn inward. Inhale back to center, both arms reach up, maybe you even look up, and then we'll do the opposite side. The left arm reaches for right elbow or forearm or tricep. And just bow over to your left, making that crescent shape with your body. What's really cool is the cycles and the sequences we find in nature. We can find those rhythmic patterns within us, right? As we transition through the seasons. Inhale, back to center, reach up and stretch up, and then take your hands, interlace them behind your head. Lift your heart up to your head, maybe lean back into your hands a little bit. Feel a big stretch in the armpits. Open up the elbows wide. Let the weight of your head rest back into your hands. And then inhale, reach those arms up again. And then take your hands down. So you can't see my hands, but I'm going to press my palms down on my thighs. That's going to give you a little more grounding energy. If you're feeling like you need to be a little more energized, you can flip your palms up. We're going to do just a gentle twist here. So big inhale, reach that left arm up to the sky. You can even follow it with your eyes. And then as you exhale, cross your body, place your left hand on your right knee. So gentle little twist here. That might be as far as you go, or start to reach your right arm up to the sky and then reach it back behind you to get a nice big open twist to stretch in your shoulders. You can keep your gaze to the side, or big inhale, sit up tall. As you exhale, maybe your eyes start to turn toward your right thumb. Big inhale brings you back. You're going to follow that right hand as it crosses the midline of your body, and then place that right hand on your left knee. Big inhale, take that left arm out, wave it up to the sky. And then as you exhale, twist maybe a little bit deeper, reaching that left arm back behind you. Inhale to sit up tall. And exhale to twist a little deeper. Big inhale, back to the sky. Both arms reach up. And then as you exhale, let a big sigh out through your mouth. Deepest exhale. We're going to do that again. Ready? Big inhale, reach up. Any tension that you have left in your body, any self-doubt, anything at all, let it go with a big sigh. You can even stick out your tongue. One more time. That felt really good. Big inhale, reach up. Feel free to even shake out your head. Good. And then settle in, start to soften your eyes or even close them if that feels good to you. We're going to go inward. Just take a few moments here to bring your awareness to your body breathing. Just notice the gentle movement of your navel lifting away from the spine as you inhale. And then draw your navel back towards your spine as you exhale. Just keep going with that breath. Inhale, expanding. Exhale, strengthening, pulling you right back to your core, the center of your center. And now we begin to just shape our breath a little bit. Breathing down toward your belly, softly letting it expand. And then breathe out slowly, steadily. So inhaling and exhaling, gently and smoothly, with no pauses in between. And just sense as the breath moves in, it recharges you, it enlivens you, renews you. And then as your breath moves out, it simply dissolves all stress, all the tension, any discomfort that you might be feeling. And just continue to breathe this way for a few more moments, sensing how this slow, smooth, steady breath is our call to be a little more present, a little more connected. Breath to heart, heart to mind, mind to body. And each time you breathe out, just sense an opportunity to relax more completely, even if it's just for a few moments in this full day. And start to allow your breath to flow effortlessly again. It's going to keep coming in and out, even if we're not paying attention. Start to bring your awareness to the top of your head. Just allow your awareness to descend down to the tips of your toes. Sense your breath as a wave that relaxes every cell in the body. Imagining that wave of relaxation from the crown of your head all the way down to the tips of your toes. And then see if you can feel that wave rise from the tips of your toes up to your lower abdomen. And finally, feel a wave from the abdomen all the way up to the crown of your head. Your whole body gets to relax here. So we're going to begin to bring our awareness to different points of our body. Let's just begin at the space right between our eyebrows. Can you imagine a little point of light there, like a star right in the center of your forehead? And see if you can relax the skin and the muscles all around that point of light. Now start to see a point of light like a star right in the center of your throat. As voters, we use our voice, right, to make change, to be the change. So sense the body relaxing even more, energy streaming towards that star point in the throat. Very powerful center for this group of women. A point of light in your right shoulder joints. See a point of light in the right elbow, the center of your right wrist. All points of light there up your arm. Tip of your right thumb. See the points of light and just notice a softening in the body around these points. See the point of light at the tip of your index finger, your middle, ring finger, and your pinky. These tiny little points of light. The body is relaxed, totally effortless. Let's bring your awareness to the center of your right wrist. Point of light there, just like a star, the whole body softening. And sense the awareness and energy flowing towards this point of light at the center of the wrist. To the center of the right elbow, center of the right shoulder joint, totally relaxed, see or feel that light once again in the throat. And we'll move our awareness to the left shoulder joint, our left elbow, sense the points of light, left wrist, tip of the left thumb, index finger, middle, ring, pinky, all beautiful points of light. See that light in the wrist, elbow, center of the shoulder, and back to your throat, that powerful place where we get to be heard from, we get to make our choices, make changes. And sense a point of light at the center of your heart center, right behind your breastbone. Let the body completely relax, energy flowing like rivers toward that point of light at your heart center. Between the breastbone and the spine, see it glowing there. Now see if you can become aware of all of these points of light at once now. You're lit up, right? You're like a constellation illuminating this beautiful vessel you occupy from the inside out. So try to stay aware of that spaciousness and the points of light while you sense the breath moving throughout your vessel. Every breath causing the tiny points of light to glow a bit brighter, like a candle that you gently blow on. And just know that you are this luminous being resting in consciousness, aware of the movement of your breath swirling throughout your vessel, your body. And eventually this light fills your entire body and even spills over into the space around you. And the body seems to just disappear in that space for a moment. So the space inside and outside are luminous. And we have this shell of the body that just kind of melts into that light. The light inside, and the light outside. No separation between the two. See if you can start to imagine yourself like a big, wide, expansive lake of light, tranquil, and slowly expanding, just a steady, radiant presence. And sense the earth below and the air above, holding you there in between. Every creature, everything, gently touched by your luminosity. Even grateful for your luminosity. And we'll slowly begin to drift back to your body and your breath. Allow the breath to deepen. And very slowly start to move your fingers and your toes. Roll your wrists and even your ankles. Softly lengthening the legs and maybe bending the knees. Lengthening the arms, bending at the elbows if that feels good. And so gently just rolling the head side to side. Stretching your neck, right ear, right shoulder, chin to chest, left ear, left shoulder, chin to chest. And you can bring your head back to a neutral position. And then when you feel ready, slowly and sweetly begin to open your beautiful eyes. Thank you so much for joining me in this little mindfulness practice. It was a joy. Please feel free to reach out. Janet will give you my contact information if you have any questions or you want to learn more about this practice. I hope you enjoy the rest of your time together. Thank you so much for all that you're doing. Thank you, Janet. Thank you all.
Thank you, Jessie, for your gift of these last few minutes. Thank you so much. Now that we have found our center, our peace, and our strength, we're going to pivot to a more intellectual approach to a topic and have our expert on universal health systems in other advanced democracies be our speaker. Harriet Seiler is the Health Committee Chair for the State Board of the League of Women Voters of Kentucky. She's been active in the grassroots health reform movement since 2004. Born and raised in Northern Ontario with friends and relatives across the North, she's well acquainted with Canada's single-payer Medicare system and has studied the universal healthcare systems of other advanced democracies. She holds a BA from the University of Western Ontario, an MA in interdisciplinary studies, and an MA in French literature from the University of Louisville. She has presented on the topic of healthcare at Murray State and Transylvania universities, at the University of Louisville, and for several community groups. Harriet, if you would share your screen, please begin. Oh, you're muted. You're muted.
Ruth, I think you have my slides.
Yes, I do. Yes, I do.
And they're not very many, but
No.
I'm so sorry.
Can you bring the slides up from Harriet's
Give me 1
slides?
second. I'm bringing them up right now.
Okay,
Thank you so much. I probably could have done it, but I haven't done a PowerPoint in a while and I realized I was losing my skills. Can everyone hear me?
Yes. And here come the slides.
Goodness, I don't know who this is.
Well, Robin's getting to your slides. It's her, your screen.
I am sorry.
You should be able to see the slides. Can everybody see them?
No, we now
no.
see a big black hand.
How about now?
Here we go. Here we go. Can you just
I'm
raise?
so sorry. It grabbed my wrong screen and now you see
Oh,
the
well,
old guy.
It's not as bad as my son. I'm sorry. Can we, how do we kind of center this? There we go. There we go.
Okay.
That's fine. My son works at a college in Pennsylvania and they recently had a speaker and it was a high-priced, highly qualified literary speaker. And when they went into their Zoom, the first thing that happened were two naked men ran across the screen. So I'm hoping we're not going to have that. All right. Now, I just thought I'd kind of situate us a little bit. I think you all know that per capita, we have the most expensive healthcare system in the world. And here we've listed other advanced democracies that also cover all their people, these countries below the United States, Germany, Sweden, etc. They cover all their people. I'm not up to date on South Korea and below, but Taiwan is usually listed because Taiwan uses the Canadian Medicare model. Okay, now this is from 2018, and every time I went to do a slide, I was trying to get the most recent, and sometimes, of course, they weren't the most recent. All right, so per capita means this is how much in 2018 we spent for each member of our population. Next slide, please. Good. Oh, well, usually I start out by saying that we have wonderful doctors and hospitals, and a lot of things, a lot of factors in our healthcare system are great. But when it comes to outcomes, we quite often do not measure up to those other countries. Okay, here's life expectancy. And this one is, well, I'm sorry, the source was the OECD, I never know what this is. It's an international economic organization, 2015. And at that point, our life expectancy was, you can see, 78.8 years, and we were well below all these other countries, okay? The Italians live long on that spaghetti. All right, and then next slide, please. Right, and this one is from 2018 again, and the one for France is not up to date apparently, but we have this terrible maternal mortality rate. Our women in childbirth are, you know, these are deaths connected to childbirth. And just yesterday, I saw an awful figure, and I can't remember, but it was a high figure on how many of these deaths are postpartum. But anyway, we should not have so many women dying. And of course, if you look at this, if you look at the diversity statistics or the racial statistics, they indicate that Black women are dying at a much higher rate than whites when it comes to maternal mortality. Go to the next slide, please. Infant mortality is very similar, and this apparently is from 2020 by the Organization of, I'm sorry, Economic something countries. Here are the deaths in the first year of life per 1,000 live births. So they make this, they use, you know, oh, there it is, the Organization of Economic Cooperation and Development, the 38 most industrialized countries. But of course, there are other organizations, Kaiser and Commonwealth puts out statistics, but I like bar charts and pie charts. I don't like the new charts that are just these long stringy lines, but anyway. All right, but this is a sad topic. We should not be losing so many infants. And of course, I'm going to be talking a lot about Canada and these other countries all cover all their people. So of course it makes a difference if all your people aren't covered. If people can't get access. Now, usually pregnant women can get access through Medicaid, but whenever somebody has a hard time getting to care, you're going to see negative results. Next slide, please. I like this. This is about the US. And this slide comes from Himmelstein and Woolhandler. And they do a lot of slides for the Physicians for a National Health Program. And I have recently discovered, and I'll probably put it in the chat at the end, you can get some good slides and that aren't kind of overwhelming, because some of the slides from the doctors are just so perfect that they're overwhelming for lay people. And I'm a lay member of the Physicians for a National Health Program. But Himmelstein and Woolhandler have a set of fairly short set of slides on publiccitizen.com, I think, okay? All right, but this shows how much of our health spending is already paid for by our taxes. And that's the tax, well, let's go this way. Medicare, regular Medicare and part of an Advantage plans, Not all. I mean, a lot of our tax dollars are going to Joe name advertising. But anyway, and then Medicaid, federal and state money, and then the Veterans Administration, public health, government workers benefits if you work for the government, and then the tax subsidies that are now going, and as far as I know, now going to help people who want to buy an ACA or an ARPA, whatever, the rescue plan or the ACA. You know, you get tax subsidies. And well, I'm kind of mean because personally, I think a lot of those tax subsidies are going to the private insurers. But anyway, they help people get care. And then this is all private spending. You know, when individuals pay and employers pay, and you pay for your drugs that out of pocket, etc. Okay, and all right, on to the next slide, please. I promised I'd only have 2 sentences per slide. Now, this kind of ties in with the last one. Now, please notice the United Kingdom is at the top there, and the United Kingdom is a truly socialist system because the doctors and the hospitals work for the government. And private insurers are trying to get in the thin edge of the wedge. However, when you talk about a socialist Medicare medical system, that's what the United Kingdom has, England, Ireland, and Scotland, okay? I'm not up to date on Japan, but France has something where employers are involved, and here's the Canadian, etc. And all of these are paid for by a country's taxes. And here, this much of ours is paid for by our taxes, you see, but we don't cover everybody. We have close to 30 million who are not covered. And this is very recent, or pretty recent, because you see apparently our grand total, in one of my earlier slides, it said 10,000 something. This is 11,006. This is probably another wool handler slide. I don't know if you can, well, we won't scoop it up, but anyway, these slides will be made available, and you can probably find them yourself. Okay, next slide, please. All right, this is a little bit wordy, but we're now going to switch to Canada, and I was born and raised in Canada, and I became an American citizen after I had 3 American children. Okay, it says it's universal coverage because it does not impede, I don't understand this part, whether by charges or otherwise reasonable access, meaning everybody has, so long as you're a legal resident, you have access to universal coverage. And you can carry your benefits from province to province, because all of these Canadian provinces and the territories. And then it's publicly administered, meaning by the government, and it is a not-for-profit program. Next slide, please. Thank you. Now, before I go to this, I do want to say that if you're a Canadian and you want vision, dental, or semi-private hospital room, you have to buy a supplement or a complement, and that is private. My mother, who's now gone, she died in 2007, but she was a retired school teacher. And the 2 things I had to take care of if I took her to the doctor or anything, she would say, "Have you got my Medicare card?" That was the first thing. And the second was the name of some company from which she had her teacher-sponsored private supplemental insurance. But all necessary medical care is taken care of by the Canadian system. Okay, I love this slide because this is a comparison of healthcare costs, US and Canada until 2017, and it probably just kind of goes up a little more recently. It goes back to when we had nonprofit, Anthem, nonprofit, Blue Cross, Blue Shield, etc., when our insurers were not for profit. And at this time in the late 60s, early 70s, our American insurance plans went for profit. The Canadians implemented, and it was right after I left, actually, because I married in 1966 and came to the States. The National Health Program in Canada was fully implemented. And you can see costs have gone up, but not like our costs. Okay, let's see. I don't know if I have, was that number 7? See if there's another slide. I don't think so. Okay, now I'm just going to talk and you can
That's your last slide, Harriet.
I do have one more. No, that's
What's on the screen is your last page.
right. Okay, that's fine. I'm just going to talk. You can, well, you can leave that up if you want, or just have something generic on the screen, or put all of us up there, I guess. Right, that's good. Okay, I want to talk about the fact that it is true that Canadians are completely covered for all medically necessary care, except the ones I mentioned, dental, vision, and long-term care is covered too, but they've had some problems with their nursing homes. A lot of them are privately owned, although publicly, there's public oversight. However, let's just say this, you never get a medical bill in the mail. There are no bankruptcies caused by medical bills. And frankly, that's another slide you could probably find somewhere, is number of medical bankruptcies in all those advanced democracies. And you wouldn't find any except ours. And we have very high rates of medical bankruptcies. Now, you've heard rumors that the Canadians have to wait. And, oh, I should go back, and each province has its own Ministry of Health. And so the Ministry of Health, at least I know Ontario more than anything else, they post wait times. And there'll be wait times for hip or knee surgery, what are called, not necessary is not the word. I'm forgetting that word you use when it's not urgent.
Elective.
Elective surgeries, right. And I mean, of course, if you've got a sore hip and you want that surgery, you can get kind of peeved, but you know you're going to get it, and you know you'll never get a bill. And the physical therapy will be covered as well. And you know, our people often have to wait, or you have to wait for a certain orthopedic surgeon or whatever. So at least the Canadians are transparent about it. I'm sure you've got snowbirds in Florida who say, oh, I had to wait. For cataract surgery is one you often have to wait for, or knee or hip, as I said. And you've also, well, that's an exaggerated piece of propaganda, saying that Canadians have to wait. You might wait and you might not wait. But I can tell you, I have a brother in Alberta, brother and sister-in-law, and if they've had anything urgent, it has been treated immediately. And my brother is right now being treated for bladder cancer. And so I actually wondered, did he have the most up-to-date care? Well, he's had 2 surgeries, and now they're using this new cellular immunotherapy where they put cells into the bladder and you try to trick the cancer cells into fighting them. And that is the latest treatment now around here. All right, now I would like, how's my time?
Yes, I'm afraid you've provided all the excellent information I knew you were going to. I also know that it's a topic that requires a lot more time than we were able to give you. But at this point, we have I'll send you a couple of questions.
Could I
following
just,
up.
could I just finish up with
Yes,
a comment,
okay.
and it will only take a minute? If you want a full description of the Canadian system, and remember it's paid for by taxes, and some with through the employer and etc. But you'd gladly pay those minimally more in taxes in order not to be paying premiums and not to be getting medical bills. Now, if you want more about the Canadian system or any country, I highly recommend, and I will post this in the chat, that you go to the Commonwealth Fund International Profiles of Healthcare Systems. And I had the Canadian one, I looked at the French one, and the German one is there. And please look at it, because we've been hearing rumors that the German is the one that people think we should have, because they do have some for-profit insurers, but they are not of great quantity, and they are supplemental, and they are highly controlled. But you can get a full description of the German and the Canadian in that Commonwealth Profiles of Healthcare Systems, and it's from 220. And you can print it out and read it at your leisure.
Oh, thank you.
Thank you,
so
and I
much.
am so sorry too. I always run over time.
But you actually were fine on time because we were keeping track. So thank you so very much, Harriet. Really appreciate it. We're going to now turn to Judy Esterquest. Judy is actually going to be defining, for those of us that are healthcare reformers and activists, well, what do we really mean by Medicare for all? What's that definition? Judy is currently the chair of the Long Island League Health Committee. And most specifically, she's co-author of the 2-year healthcare study from 2019 to 2021 that the New York State Healthcare Committee worked on as a position update for the New York State League. She is certainly a presenter at New York State educational meetings to adopt the new position that has been drafted by the study committee, and also the New York State League endorses the New York Health Act, which is a state level single payer Medicare for all piece of legislation. Judy, can we bring Judy up?
Start by unmuting myself and then screen sharing. Let's see. Almost works. Let's see if we can do this. So I want to first start by saying thank you, Harriet, for bringing up some slides that I'm going to use. You can tell these are favorite slides, and I'm using them in a slightly different way, but I'm really glad that these very important slides have been introduced so people won't be blizzarded when I go through them much faster. And I also want to thank Ruth, because the New York Health Act is something that I've been seriously advocating for. For a decade, I learned about healthcare as a patient advocate for my husband, and now I advocate for healthcare reform. Medicare for all, absolutely, but the New York Health Act is single payer at its finest, and it's kind of been exciting the last 5 years to see the Sanders bill move closer to it and the Jayapal bill move closer to it. So I'm going to start by saying Ruth asked me to define Medicare for all. And so I'm going to articulate the distinguishing features of single payer healthcare, Medicare, multi-payer, and explain why all this matters. So what principles does the League of Women Voters support and has for 30 years? First, healthcare should be universal, regardless of skin color, income, or where we live. Equitable. We should all get the medical care we need, including prevention. It should be affordable for treatments, tests, prescriptions, and for patients, taxpayers, and physicians. It should be funded by general taxes, stewarded well. Universal, equitable, affordable. Keep those in mind. What kinds of health care do we have now? Well, Medicare Advantage and Medicaid and for-profit insurers like what you have in Manatee County, Aetna, Humana, Florida Blue, are multi-payer. Your doctor bills, some combination of you, your insurance company, your county, your state, and CMS. Whereas original Medicare is single payer. Your doctor bills the Center for Medicare and Medicaid Services, CMS, and your doctor works in a nonprofit or for-profit setting, private delivery. The VA, like the Indian Health Services, both American, are socialized medicine, which is one kind of single payer. But unlike Medicare and Medicare for All, the government owns the hospitals and employs the healthcare workers, as Harriet said. So what characterizes single payer? First, publicly funded. Taxes pay into a trust. That trust, which is the single payer, pays all the providers. There's uniform eligibility and coverage, like Medicare, like the VA. Everybody's on the same policy. Reimbursements are standardized, whether the patient is rich or poor, a general or a private. It costs less. Simplified processes cost less than complex ones, and the cost structure is transparent, so costs can be controlled. But single payer comes in many different flavors. What does our Medicare look like? It's skinny. Taxes pay for healthcare, doctors don't work for the government, and everyone over 65 has essentially the same coverage rules. But it's got gaps and limits and cost sharing built in, which require gap insurance, which means most seniors experience it as multi-payer. It's an ugly secret, but seniors still face financial ruin from medical bills, particularly if they buy Medicare Advantage and then get really sick and need out-of-network specialists or hospitals. P.S. Medicare Advantage plans are now twice as profitable as any other health insurance. Where do they get those profits? Off us. But how many of us would give up Medicare for what we had before? Not many. So what about Medicare for All bills, such as those introduced by Sanders and Jayapal? They're public funding, they're private delivery, one coverage policy, uniform eligibility, and all American residents have comprehensive benefits, or will if they get passed, including what's not covered by Medicare now. A lot of that is healthcare above the shoulders, teeth, hearing, eyes, behavioral health, as well as long-term services and support, that is home care. It covers everyone and it costs less than now. Does that sound too good to be true? Only because so few of us see how our current system betrays our health and drains our economy. What characterizes for-profit multi-payer healthcare, which, as you've heard, distinguishes the US from every other advanced country? Paperwork and red tape, delay and denial of care, extraordinary profits. Ask yourself why your doctor's office has so many people in the back room managing billing and insurance. Delay and deny are best practices. For-profit entities focus on their own business models, attracting profitable customers who don't use healthcare, dropping customers who do use it. Why do big hospitals keep buying up smaller ones? Why is private equity renting ER doctors to hospitals? Market power. If your hospital owns all the hospitals in the area, it has more power to set prices. If your insurer serves the biggest employers, it can reduce reimbursements. How much does a doctor visit cost? An ER visit, a lab test. The same service can have dozens of different prices. So what does funding flow look like in a multi-payer system? A mess. And as messy as this looks, it's actually simplified. Starting at the left, businesses and the government and people send money and get money from many entities. Ditto for doctors and hospitals. In 2015, the Massachusetts Attorney General sought clear cost and quality information from doctors, hospitals, and insurers, and then gave up. Getting good data proved impossible. We cannot control healthcare costs because the system itself makes them opaque. So what does single payer funding look like? The blizzard of paperwork drops to a trickle, like Canada. It spends funds designated for healthcare on healthcare, not overhead. For-profit insurance keeps 15 to 20 cents of every premium dollar, spending 80 to 85 cents on patients. Medicare keeps 2 cents, spending 98 cents on patient care. Even the Mercatus Foundation, a conservative think tank founded by the Koch brothers, concluded that Medicare for all could provide more health services to more people and still spend less than we spend today. So is Medicare for all better just because it would cost less? I'm going to click through the next 10 slides pretty rapidly, because as tragic as these details are, the conclusions are worse. Our current multi-payer system costs us too many dollars, true, but it also costs us too many lives. In 2019, the white dotted line was the average life expectancy for members of the G7, the richest industrialized countries. White Americans lived 2 years less than our counterparts. Native Americans lived 7.5 years less. And then came COVID. French life expectancy dropped 7 months. Germans lost 3 months. White Americans lost 9 months. But Blacks and Hispanics devastatingly lost about 3 years. You've seen this slide. You've seen something like this slide from Harriet. Maternal mortality, a scandal. These 14 peer countries all provide universal, publicly funded prenatal and postnatal care, keeping more mothers and infants alive. But the red line, for 2 decades, more and more American mothers have died, and you can find similar charts for infants. What's worse, Black mothers die at 3 times the rate of white mothers. Here are the 5 leading causes of death for all Americans. But more Black Americans die from these causes, and they die faster, at double or triple the rate of whites. And more rural Americans die faster. For cancer, it's 4 times the rate. And 86% of these deaths are preventable. These numbers are American lives. Americans aren't getting what citizens of peer countries get routinely: prevention, early diagnosis, effective treatment, affordable care. Americans fear seeing the doctor. It costs too much. Is it really our multi-payer system, for-profit system, causing these health disparities, unhealthy lives, and early deaths? Yes. Let's look at the Veterans Administration. Below the red line means better health outcomes for Blacks than whites. In the VA, Blacks live longer than whites, have fewer strokes, and many fewer new cardiac events. Among kidney failure patients on Medicare, Blacks survive longer, and Blacks, whose life expectancy lags whites, as we've seen, quickly catch up if they live long enough to join Medicare. Universal health care saves lives, even in America, even for Blacks, even for rural people. So our life expectancy over on the bottom right lags our peers. We're like Chile and the Czech Republic. And we spend double or triple what our peers do for these worse outcomes. And as Harriet asked you, but our taxes are lower, right? Wrong. The turquoise lines are the total healthcare costs paid by taxes, as Harriet pointed out. And we pay more in taxes for healthcare, and then we pay $4,000 more per person. Do we get more healthcare? Again, I'm going to click through these slides in each case, the yellow bar is the US. We see doctors 4 times a year. The Japanese see them 13 times a year. We spend less time in hospitals, and we have 1/3 of the hospital beds per 1,000 people than we did in the 1960s. We have fewer nurses, the bedrock of good care. We skip care more often, a lot more often. Why? Because even with insurance, we can't afford healthcare. For-profit insurers insist that cost sharing means skin in the game, but delaying care means profits rise while we get sicker. I was astonished to learn a couple of years ago that 90% of the 3.5 trillion Americans spend on healthcare goes to people with undermanaged chronic conditions, like diabetes. Yet Americans skip their prescriptions more than do our peers. Note the bottom line, the length of it relative to the other lines. 2 to 4 times they skip more. Multi-payer insurance also extracts a huge administrative burden. The yellow area of the chart shows the increase in doctors since 1970. The pale blue shows the increase in administrative jobs, billing, payments, insurance denials. Today, armies of administrators hired by providers seek payments. Armies hired by insurance companies deny payments. Hospital, okay, sorry, I just got myself lost. So at Duke Medical Center, there are 957 beds and 1,600 billing clerks. The cost to send bills for one physician, almost $100,000 per year. This isn't medical care, $100,000 just for billing. Hospital charge masters, the list of prices are supposed to be posted. The Cleveland Clinic estimated it had 210 million prices. So many policies from so many insurers, from so many payers, for so many services, 210 million different prices within one hospital. Is that unbelievable? Canada has no such thing. The blue line, this is the chart you've seen before, is US healthcare chart cost from 1960 to 2020. The yellow line is Canada's. Note that in the 1950s and 60s, Canada's healthcare cost tracked ours. Then Canada enacted single payer and their healthcare cost increases slowed. Why do Americans pay about $5,000 more per person per year for their healthcare than Canadians? Well, a study last year showed that every American pays $3,000 on average for the privilege of having our multi-payer for-profit system paperwork. Incredible, no? These are the billing and insurance and denials and appeals and prior authorizations and all the things that create basket full of paper if you have a loved one in the hospital. Incredible, no? But
Judy, your information has been absolutely incredible, and your presentation is very, very compelling. It's so important, and yet we are at the end of the time we have allotted and another speaker. So we will be posting all of Judy's slides. And Judy, if you would take a moment to summarize what you might want to say.
Absolutely. So I'll go quickly to my favorite slides, which are, oops. So my favorite slide is we rank 17th out of 17 countries in life expectancy, and that remains steady until we reach 65. And then what happens? Within 5 years, that we start getting better. People live longer. And by age 80, Americans live as long as the oldest living countries that we are typically compared to. I wonder if it's the water. Thank you.
Thank you so very much, Judy. A fabulous presentation on a topic that certainly is important to all of us. What we'd like to do is we had started this program with the status of health of the residents of Manatee County. And we are going to turn to Runa Badal as an expert in what we have as Manatee County's Community Health Improvement Plan with a focus on healthy living. Runa is the Community Health Director at the Florida Department of Health in Manatee County. She has over 17 years of experience at local, state, federal, and national levels in health and human services. Areas of focus include policy, leadership, and community engagement and empowerment. Most recently, on behalf of the Florida Department of Health in Manatee County, she received the Model Practice Award from the National Association of County and City Health Officials for the power of partnerships in fighting the opioid epidemic in Manatee County. Runa, if you will take over and share your screen.
So thank you so very much, Ruth, and hello, everyone. Ruth, to be respectful of time, do I have about 4 minutes or 3?
Well, we're going to allow you to run a little bit over. We may lose a few of our participants, but you have too much. I know how much information you have to share, so you have your allotted, the standard 15 minutes that we
Very
had
good.
told
Well,
you would
thank you
have.
to all, and thank you for the participants for staying with us. Harriet, what a great presentation. And Judy, I feel like you both work with us. We just did a green belt, a Lean Six Sigma green belt project here at the Department of Health this year on infant mortality and breastfeeding. And we studied Black infant mortality. And I feel like you both actually work with us because you spoke our language. And thank you so much for highlighting the areas that you did. Can't wait to hear and read more from your PowerPoint presentation. So I'm going to pick up where Dr. Bencie left off. She was talking about the pretty much how Manatee measure health. So we typically do a community health assessment every 3 years, Dr. Bencie mentioned. This is not just a requirement from the Department of Health, but it's also a requirement from the non-profit hospital in the area. The only nonprofit hospital in Manatee is Centerstone Behavioral Health Hospital. A lot of people think it's Manatee Memorial, but it really is Centerstone. And it's an IRS requirement for them to do it every 3 years. So we just align forces. Melissa Larkin-Skinner, who presented earlier, is the chair of the Manatee Healthcare Alliance. And that group is a multi-sector, multidisciplinary group that meets every month. They've done amazing things. Dr. Bencie mentioned the community paramedicine program, but they continue to keep an eye on, once we do our community health assessment, we then do a community health improvement plan. And so we have subcommittees that focus on these areas. We are actually in year 1 of our 3-year process. And so I'm going to be highlighting what we call our community health improvement plan through our annual review. So if you give me one moment, I'll bring up my PowerPoint and share it with you very quickly. Ruth, and if you can be so kind to let me know if you're able to see my screen.
Yes, we are able to see. Thank you.
Very well. Okay, so I'll just skip ahead. All right, so we use the National Association of County and City Health Officials, which is also called NACHO. They have a mobilizing for action through planning and partnership, or a MAP process. This is the gold standard for conducting the Community Health Assessment, or CHA, and the Community Health Improvement Plan, or CHIP. You'll hear me say CHIP from now on, with community stakeholders. This year, we identified 6 strategic issues which were brought under 4 CHIP subcommittees. They've wrapped up year 1 of their respective action plans, and each subcommittee includes a chair, a co-chair, and a liaison from the Florida Department of Health and Manatee for support. They have a focus on health equity and access within each of the action plans that they're working on. So the Youth Development Subcommittee is working to improve the physical, social, emotional, and mental health for youth. Current projects include a survey that address barriers regarding access to school-based health clinic, conducting an inventory of age-appropriate services to improve the physical, social, emotional health for youth. They're doing a lot of other work. This group is extremely active. It's led by Dr. Skip Wilhoit from the school district, and again, they're really addressing serious issues looking at youth, not just in school, but out of school youth as well. Next is healthy living. And I would like to take the opportunity to thank Ruth for her leadership as chair. This committee is the only one tackling 3 of the 6 strategic issues. They're working on obesity, nutrition, and diabetes. And I'll talk more about the healthy living CHIP subcommittee in the next few slides. Our communicable diseases, they're addressing social determinants of health, health equity, and health disparities through education and health promotion. And behavioral health, you heard a lot of that from Melissa Larkin-Skinner today. They're focusing on addressing mental health, substance use and misuse, and suicides. If you talk to any target group, you'll hear suicides continue to be a key issue, whether it's youth or veterans or seniors. Any group that you talk to, first responders and EMS, it continues to be an issue. So they're working on holding a behavioral health and substance use, misuse equity forum in March 2022. And so once we have more information, we'll be sure to share that with you. The Healthy Living CHIP subcommittee, again, our esteemed Ruth Herringer leads this group. They've been very, very busy. The co-chair for this group is Molly White. She's with Manatee County Parks and Resources, and our liaison is Anastasia Peel. Other partnering organizations is American Heart Association, the Early Learning Coalition, Healthy Start, the League of Women Voters, Manatee County Government, Meals and Wheels Plus, MCR Health, the Multicultural Institute, UF IFAS Extension, Family Nutrition Program, We Care Manatee, and the Manatee Y. This group is very active, and they're taking on some very big topics and issues to resolve. So the county health rankings identified adult obesity as an area to explore in the 2020 Manatee County profile. In Manatee County, we have higher rates of obesity in mothers during pregnancy than the Florida rate. Overall, the county has higher rates of overweight adults among non-Hispanic whites than the Florida rate. And for Blacks and Hispanics, there are higher rates of obesity than the Florida rate. Manatee even has a lower rate of amputation of lower extremities that is attributed to diabetes than the Florida rate, but the trend is increasing overall. Like previous slide said from prior presenters, Blacks and Hispanics have a higher rate of health issues to include amputation of the lower extremities than whites. I'm gonna change my slide a little bit here. With healthy living, the goal is to improve access to healthy food and increase physical activity. They are working on a physical activity matrix. They've listed various facilities, adult and youth leagues, parks, preserves, boat ramps. Within this matrix, they're working to increase participation in gyms, community centers, every access that they could possibly put together to increase physical activity. We're hoping to publish this in My Sidewalks, which is a platform that Florida Department of Health in Manatee County, we have that and we're working on setting that up. We should be doing a soft launch either January or February. So Manatee County also has pockets of where we have a food desert. So one of the areas for healthy living is to increase access to healthy food and nutrition by 2023. A food desert is where it's difficult to buy affordable or good quality fresh food. We know our 34208 zip code. We are located in a food desert. I hope to invite all of you, whenever you have a moment, to come visit our Manatee Square Garden. It's one of the largest gardens in terms of a health department that we have on our property. We have all kinds of education classes that go on, not just teaching about fresh food and nutrition, but how to even prepare those foods. And it's outside, it's beautiful. If you want to plot, let us know. It's $25 for the year. It really not just helps with the classes, but the socialization, getting to know members from the community. And our garden here has been benchmarked by various top hospital care systems, in not just in Florida, but in the nation. Whenever they come by 64, they've actually benchmarked that. So we're very proud of the garden. But in terms of this CHIP subcommittee, they're looking at a program called Go Knapsack, which is the nutrition and physical activity self-assessment for childcare. This is an evidence-based program for improving the health of young children by enhancing practices, policies, and environments that instill habits supporting lifelong health and well-being. This program has key topics such as healthy eating, physical activity, and oral health. In addition, the Florida Heroes ECE recognition is a voluntary recognition program, and it is open to all ECE centers in Florida that are licensed by the Florida Department of Children and Families. This program recognizes the ECE centers, which is early childhood care centers, for integrating and following the best practices to provide healthy food, offer healthy beverages, support breastfeeding, increase physical activity, and limiting screen time. Another goal of this group is to increase breastfeeding rates. The subcommittee designed a toolkit to promote Breastfeeding Friendly Employer Award. This award recognizes businesses that are providing support in the workplace to their breastfeeding employees. Businesses are evaluated based on a set of criteria. They can either get gold, silver, or bronze, and we help with promoting the toolkit and working with employers to apply for the award. We already have 3 recipients of the Breastfeeding Friendly Employer Award, the Early Learning Coalition, our offices here at the Department of Health, and Manatee Memorial Hospital. We continue to offer support services to the community and collaborate through Healthy Start, the 0 to 5 Coalition, Whole Child Professional Network, and the recently formed Breastfeeding Coalition. another goal, you can tell this group is very active, is to increase access to diabetes, medication testing, and treatment. So they're working diligently to address the goal of recruiting endocrinologists in Manatee County. Manatee County is an endocrinologist desert. National standards state that there should be one endocrinologist per 40,000 people, and there continues to be a shortage in the nation. We actually gained an endocrinologist in December 2020 at Intercoastal Medical Group, and another in November 2021 in MCR Health. MCR Health and Blake Medical Center both have diabetes self-management programs. And so the subcommittee is looking for ways to disseminate the program information in the community. So kudos to the Healthy Living Group. This is a big win in our community to attract top talent in our area and to get not just one, but 2 endocrinologists in our area is a pretty good feat. So congratulations, Ruth, to you, and thank you for leading the charge there. So in terms of next steps, we're moving into year 2. Next year, we're going to be starting the 2024-2027 community health assessment process. That takes about 18 months. And if you'd like to be a part of this process and join the Alliance, please let us know. We'll be more than happy to have you. So sorry, same thing happened to us. Our phone never rings. And the one time we're doing a presentation. Ruth, with the last few minutes, I would like to take the opportunity to, if I may, this is a very quick video. And this video is very important to us. We just made it, but hot off the presses, just as this wonderful presentation was going on, we actually placed #1 out of 158 submittals. We received #1. And what we would like to share this video, and you'll see why, one of the reasons, and this is being recognized among our peers. This was in partnership with the Bishop Museum of Science and Nature, the Manatee Healthy Teens Coalition, the Vax Up Manatee Coalition, and our DOH Manatee team. We are just so proud. We all want to have those we're #1 signs, you know, to be waving around. So I would like to take the opportunity. It's a very short video. We're going to have it up on our website if you can share it. We just won at 42%. We were going to show the video anyway, but that's just the idea that we just won, beating out 158. We're very proud. Before I start the video, I want to share with you and anybody and your loved ones, your friends and your neighbors. If you are vaccinated and you want a special treat, I see a lot of head nods, right? I'm going to invite you to take your, you know, that COVID vaccine card that was issued. And if you don't have it, right, come on down. We'll make sure if you lost it or something, we'll get it reissued to you. But take your card to any Mencie's frozen yogurt for a 5-ounce frozen yogurt for free. And you can do this as many times as you like, okay? So you don't have to wait until you get the first shot or the second shot or the booster. Just start taking your card right away. And we're just very grateful that Mencie's and any one of the Mencie's that's close to you to help support that. So just a little treat for taking some time to protect yourself and others. So if you just give me 1 minute, I will show this video. Ruth, how would you like to take questions? I'd like to be respectful of everyone's time. I'm happy to answer any questions either by email. Tell me how we want to proceed. This video is also very short too.
Yes.
Few seconds.
In terms of questions, we're going to pull all the questions from the chat and we'll work with you on making sure we can address those.
Perfect.
We're
Perfect.
running over, so we won't take any questions right now. but please go ahead and run the video.
Okay, and should you have any questions or any way the Department of Health can be of service to you, please let us know. When travel opens up, we also do travel vaccines. So when that becomes more of an option, please visit us, come see us. We have quite a few services for you as well. So it's not just a COVID vaccine, it's other vaccines too. With that, I'm just going to share the video very quickly. I have it queued and I just have to stop sharing screen. I'll stop chatting, but I do want to wish all of you a happy holiday season from all of us here, and be safe, be healthy, and thank you for the extra time. I'm going to mute and bring up the video.
Runa, you might have to jump back on and share your screen again.
Will do, yes. Okay, let me try that again very quickly. Thank you.
Runa, I'm afraid for some reason the video is not coming up. And so I think at this point I need to move us on. I'll make sure that we tell all of the attendees how to find the video on the website. And we're very excited that you were able to have such an award-winning video put together. At this point, I would like to turn the close of our program over to Janet. Janet will remind everyone about their digital goodie bag, et cetera. But I also want to, behind the scenes, make sure that we acknowledge Robin Davis has actually been handling our Zoom technology. She's a member of the League on the Health Committee. She's adult thesis student at the New College of Florida, and she's a freelance graphic artist. And she did all of our publicity materials for this. So a great thanks to Robin. And now I turn it over to Janet. Thank you.
Thank you, Ruth. I just want to thank all the speakers, everybody. Give a nice little silent round of applause to our speakers and guests today. It was an amazing program. Thank you again, Ruth, for your leadership on this. And Robin, thank you for all of your help. I just wanted to close out this program by, again, reminding you, if you have not downloaded your digital virtual goodie bag, in there is included a Starbucks gift card on there for you to use for one drink for today. There's also resources that all of our guides and speakers talked about, and more info about Jessie and what she offers as well. And finally, you can find more information about the League of Women Voters of Manatee County in there as well, including how you can get involved and how you can get more active in our league. Again, we just wanted to thank everybody for being involved today, taking the time out of your busy schedules to be with us. And so have a happy Friday, a great weekend, and an early happy holidays. Thank you.